Good afternoon, everybody, and welcome to our UT Swarps Tennessee Strong Families Ask a Professional series featuring doula services, our kickoff today. My name is Brooke Blair. I'm the training specialist for the Swarps Tennessee Strong Family Support Team, and I'm joined today by our presenters, Rachel Towers Brooks and Alyssa Claxton, who are from Open Heart Doula. Today, we're going to kick off our Ask a Professional series featuring our doulas. We're hoping that these Q&A conversations support the subrecipients as you help families better understand the different types of perinatal professionals that they may meet during pregnancy, birth, and of course the postpartum period too. There's going to be time for you to ask your own questions, but we've planned some that they have gotten as frequently asked questions from expecting parents that they've worked with in the past. So please feel free. This is going to be just kind of a lax question and answer time. Take yourself off mute, put things in the chat. We want it to be a learning experience for all of us. So I will go ahead and ask our doulas to introduce themselves. Rachel, if you'll go first and just tell us a little bit about yourself, and then we'll hear from Alyssa.
Hi, my name is Rachel. I've been a certified doula for 9 years. We practice in Knoxville, Tennessee through our group called Open Heart Doulas, but I'm also a childbirth educator. So we help mamas learn and educate and grow and have hopefully non-traumatic births.
Yes. Hi, I am Alyssa, and I have been a birth doula for about 16 years. Started my journey working at Lisa Ross Birth and Women's Center here in Knoxville, and just really love supporting women through this time.
Awesome. Thank you all. We're glad you're here. Welcome.
Yeah, thank you.
All right. Rachel, can you describe how your role or the role of a doula looks in the day-to-day support of an expecting family?
Yeah, so part of what we bring to, families are like I mentioned, the education, but we walk with a lot of families prenatally. So we're helping them with their appointments and checking in after them and, giving them little tips and tricks for normal pregnancy discomforts, and then also helping them figure out, yeah, no, this is probably something you need to reach out to your provider for. And then we walk with them all the way through labor. We give them continuous labor support, and then we do move into a little bit of postpartum support immediately afterwards to kind of let them transition from that like pregnancy state to the postpartum state.
Okay, great. And you mentioned meeting with families in the prenatal period. At what point do you all suggest families reach out to a doula? Are we looking at 4 weeks pregnancy, 34 weeks? What do you think is best?
Yeah, we have honestly, it runs the gamut. So it's never too late, really, to hire a doula. We have mamas who call us as soon as they pee on a stick, and then we have some who wait until far later into their third trimester because as the due date starts coming closer,
Yes.
they start to get nervous or anxious, and so that's oftentimes when doulas are physical support, non-medical physical support, but we are also mental and emotional support as well. And so, really walking through those fears and anxieties is a key aspect of what we do. And so it's probably it's like any time is a great time to reach
Oh,
out
we've
to
had
us.
a client that reached out that said, "My induction is set for tomorrow. Can I hire you now?"
Yeah.
So
Okay,
any time.
great. And what does the final stages, we may say like 37 weeks and forward, what kind of support does that look like as far as like availability for a normal doula?
I mean, so because of the unpredictableness of what we do, and babies really run the show, they get to tell us when we go to work. It's hard for us to say like what our availability is in the long run. A lot of doulas run the gamut of 1 to 2 a month, some are more 5 to 6 a month. Alyssa and I are in a partnership, so that business model looks a little bit different. But typically, what would you say? Usually finding a doula to help a mama in need. Our heart is for serving families. And so usually you can find one that has an availability to help you.
Hey, all right. Alyssa, how does your work complement medical or obstetric care during pregnancy? Rachel just mentioned it's physical support, not medical support. So talk to us a little bit about that.
Right. I think a lot of that comes in the prenatal education. So it is part of our job to just kind of help with that familiarity of the medical realm and like what are the decisions that are to be made? What is the normal process that you're going to go through with your provider? What kind of questions are they going to ask? How can you be armed with the right information? And just to help them to be a more active participant in the communication and the conversation, so that they feel confident in that ability to kind of navigate the medical world. Um, Knowing that is an essential part of the team. One of the things that we often tell our clients is like the best, most important decision, first decision that you make is choosing a care provider that you truly trust with your medical care, because that is an essential ingredient in the process, is having that like trust relationship. And then as you kind of walk through your own personal choices and decision making, like we can kind of help navigate just that space of what the choices are that are to be made.
Great. And when you talk about childbirth education in some of those early stages, is there like a set curriculum that you all have made for yourselves, or do you use, what kind of materials are you using to do that education?
Yeah, we both teach different childbirth education courses. Rachel's course is a little bit more faith-based. I use just kind of a very general evidence-based kind of curriculum for that. But it really, the education piece going into it really is like, what is your motivation for the kind of birth experience that you want? So whether our class is the right fit, or we're directing them to Bradley method or hypnobirthing, like there's a ton of different types of childbirth education curriculum to choose from. It's just kind of help, figuring out what the goals are for their particular birth experience.
Okay, that makes sense. So you would say it depends on what the mom's wishes are for what kind of birth that she wants to have.
Yeah, and if they're choosing to birth at a particular facility, and if they offer classes that are specific to their environment, like sometimes that's the best fit too.
Gotcha. Okay, awesome. All right, Rachel, I love this question. What are some common misconceptions about doula services? I'm sure there are plenty, right? And I'm sure some of our subrecipients will share things later that they've heard too. So maybe we can clarify some of those today.
Yeah, we both had one. Trying to think. So I feel like there's often a misconception about how doulas advocate for families. There is this world or this narrative that doulas are the advocate, that we are the ones advocating for what the mama wants. And in reality, it's through that prenatal education where we empower those moms with knowledge and what their choices are and what their options are, and then they get to decide what's best for them. And it really looks like us saying, hey, you have these two choices. Which one sounds best to you? Or, hey, your doctors and providers are saying this. Do you understand what's happening? And so what we do is we slow down sometimes, in as long as it's not emergency, like we slow down the pace of the questions that a lot of like the medical model will throw at a pregnant expecting family, a laboring mother who's in the middle of contractions while trying to make big decisions. um, you know our job really is to make sure their voice is what is heard and it's their decisions that are being made, versus us coming in and saying, well, she didn't want that. So we're not going to do it, right? Like advocation looks different truly as a doula than I think what some people maybe initially
Mhm.
understand.
Great.
And the big one is always like, we know that we are not the medical provider.
Yeah.
We are not a midwife. They are not synonymous. Our role is to help navigate the medical world, but it's not to make the medical decisions. And that is still an essential ingredient and essential part of the team, to have someone who is in charge of your medical care.
Great. And I think that makes sense that you will help advocate for that too, because how do you effectively make decisions about your medical care if you don't understand the jargon that they're using or you don't understand the things that they're pushing? And so I feel like doulas are a great bridge between those two things. So thanks for
Yeah,
that.
and that often looks like us saying, "Hey, did you understand what they just said to you?" And like, do you have any follow-up questions, like just to help navigate that space of decision making, especially when you're in labor, because it's really hard to think through those choices. So if we get to do a lot of the work on the front end in the prenatal sessions and kind of guide, like these are the things that we know to be true, about how your birth could go, um, then it just arms them with the ability to think it through a little bit more clearly, even while their brain is in labor.
And then when the providers come in and go, well, what did you decide about this? They're like, oh, we've already predetermined our preferences. And so it's an easy, low-hanging answer for them, to be like, oh, my partner and I, my support person, we've just talked this through. So
Absolutely. Yeah, it takes away the shock factor. So it's
yeah.
great. Awesome. Okay, Alyssa, how do you work alongside other professionals like nurses, home visitors, or case managers to support families? So kind of in the same realm, but um, less doctors, more of these guys. How do you all partner with them?
Yeah, I mean, we partner with a lot of different medical providers, and one of the big questions that we ask during our prenatal sessions is who's on your team? Because
Mhm.
that could look different for different people. So, do they have a physical therapist that they're working with? Do they have a chiropractor on their team? And then just kind of guiding some of that space of, we think this might actually be a really great resource for you. And then in the birth room, it really is just building those relationships, just like we're building our relationships with the clients. Like we want to come in with a team mentality that, we love and support nurses. How can we all work together to help this particular mama get the experience that she wants? And so we love being a part of the greater birth professional world, and kind of just building those relationships across the board.
Yeah, I love what Rachel said earlier too about being there through shift change, right? Because it's like a mom may see 8 different nurses during birth, right? But you all are the constant and, can take notes and relay to the providers and, hey, here's what happened yesterday. Here's, I do feel like that's a great advocate for the mom to have as someone who's kind of been there along the way. Even, sometimes when they see bigger OB practices, they may see a different doctor each week or things like that. And so I love that a doula can be the constant and kind of have everything information wise about this mom in one place. So I love that. Okay. Rachel, what types of doulas exist? Birth, postpartum, etc. And then how do their roles different from maybe what you all do?
Yeah, so I think the two big categories for doulas are the birth doula and then the postpartum doula. And it really, we do the same things, our just day-to-day job descriptions look a little bit different. So a birth doula, like what we are, is again that prenatal education, that continuous labor support through all the shift changes, being that continuous care kind of start to finish for what we would call like the main event. And then postpartum doulas come in usually more in the home setting, and they're helping with the nighttime rotations and the feeds and sometimes light house duties like housework, dishes, bottles, that kind of thing. Helping moms take a shift of sleep, because sleep is part of the healing process that a lot of moms don't actually get. And so how would you, I mean, can you think of others? I'm trying to think.
As far as different types.
Yeah.
I also work as a bereavement
Yes.
doula, so that's kind of a little bit of a different world. If there has been a loss before or shortly after having a baby, and just kind of walking through what that looks like, the different kinds of decisions that there are to make in that. But those are kind of the main types of doula support.
Okay, interesting. I did not know that bereavement doula was a specific thing. That's also great to know. Yeah. Okay. All right. Alyssa, how do doulas adapt to different birth settings, hospitals, birth centers, or home births?
Yeah, I mean, we easily, yes, we love it all. Um, each different type of facility is going to come with its own charms and different aspects. So I think it's crucial for the role of a doula to know their providers, to know their hospital facilities, because that has to come in the decision making of like, okay, you have chosen a hospital birth. This is your provider. This is what I know about them, about their personality, about the things that you might face in this particular situation or scenario. Home birth is a whole different world, and it can be really beautiful, and just making sure that you have, again, that it just coming in as like choosing the provider that you really, really trust with your care. So yeah, I don't,
Yeah.
that's a tough question, but we love it all.
Yeah. I think it's also important to really spotlight the fact that if a family, trusts us to hire us and have them walk and journey with them, we're with them regardless of where their birth happens. So we do have situations where families are planning a home birth and for whatever reason a transfer needs to be made and we have to pivot to a hospital setting, and the beauty of what we do is we are going to help you. It's like that Dr. Seuss, I'm like, we'll help you birth in a house or next to a tree, but also in a hospital or in the tub. Like, it's wherever you decide to birth, like that's kind of where we are going to help and hold their hand and help them bring a baby into the world. So in some cases, like those hard pivots where there's a transfer, it brings a lot of reassurance to the moms that there's going to be one person in her team that's going to stay consistent no matter what.
Absolutely. And that kind of makes me think too, like whenever a mom may end up going from low risk to high risk during a pregnancy, how do you guys kind of help them navigate all of those choices, maybe with their hospital or with their providers, or when they have to switch from having this home birth that they really wanted to something that's a little bit more medical intervention heavy? How do you help them process through that?
Yeah, I mean, it's obviously a big heart change when something has totally changed and they feel like, oh, I had this birth plan and now it's gonna look totally different than I expected. So really just walking through that with them, and finding the spaces that the questions that they're uncomfortable with, or the parts of the plan that they're uncomfortable with, and then helping to familiarize themselves with um, what that pivot looks like. Like, okay, we're moving to high risk for this reason. So now these are the decisions that we have to make. It may change your birth plan a little bit, but how can we hold like the most important things to you intact even through that shift in different types of birth and different types of providers?
Right. Yeah. It sounds kind of like you help them prioritize too, like what is most important to you? What is the big outcome? Which is great. All right. Rachel, what impact have you seen doula support have on birth outcomes and postpartum adjustment?
I'm laughing because I feel like I'm on a show. This is your question. Um, I feel like doulas, because of how we journey with our mamas, we have a certain level of trust built and instilled with our clients. And so we are oftentimes the one they reach out to first when they're having some postpartum symptoms that might be more concerning. And a lot of studies show that those moms at risk will typically only tell one person. And so we walk along. That's why our postnatal model looks like a home visit, sitting on their couch and getting eyes on them, so that we can kind of be like, hey, how are we adjusting? How is your sleep? Is it something where this is just exhaustion, or is this something where we need to really take seriously and do more home visits or check in with the provider, and make sure they're not being like left in the cracks or lost in the cracks.
Yeah.
In terms of birth outcomes, I feel like there's just a lot of research that shows moms who hire a doula are just happier about their birth. Even if there's been hard pivots, the amount of moms were like, wow, that was really hard, but I'm so glad you were here because, again, it's designed to be, our world is designed to be in community. And as we get more and more isolated, it's harder to keep that in mind. And so what we provide is that continuous, like, connection, that relationship, really start to finish, and not just like, oh, your baby's here, we're all done, right? It's
Mm-hmm.
really walking through those crucial weeks before and after.
Mm-hmm.
Absolutely. Well,
Number of
and it's like,
texts that we get of, is this normal?
Yes.
And a lot of times it is. Most of the time we can say yes, everything is normal in pregnancy. But then there are times when we get the one question that we're like, actually, let's talk to our provider about this one because we want to take this a little bit more seriously.
sure. Well, and I think it makes sense because again, like you all are attending one of the most life-changing events with these people, right? And so you have like built this crazy connection with them that, they'll never forget you, I'm sure, as they move on throughout their life. And so you do have that trust and connection and ability to catch some of those things that somebody else may not. So I think that's great. Alyssa, tell us a little bit about, we were talking the other day about the MMR report and what one of the interventions that was recommended as far as doulas go. Tell us about
Yeah,
that.
it had just it was speaking to the maternal mortality rate in the United States and how poorly we are doing in Tennessee. And one of the suggestions in moving towards improvement was doula support. And I think it's simply for that reason that we just mentioned, is that we are going to be the first person that they think of when something feels a little bit off. And rather than ignoring it or trying to walk through that alone, just having that support of like, hey, how much bleeding is too much bleeding? And being able to say, hey, I think we need to go in. Would you like me to go with you? So that I think is where in that space that we can help to make those improvements. Is just making sure that people's voices are heard and that they're taken seriously and that they're taking themselves seriously. Like, this is not a burden or a bother. Um, this is a medical issue. So let's do something about it.
Yeah, I
Sure.
agree.
Well,
The accessibility of having a doula, like between a mom and her doula, is an intimate thing. Like, we are the 3 a.m. phone call when they would just get a nurse hotline, right? And then maybe a call back in an hour. Whereas we're designed, and our model is, we wake up for the 3 a.m. phone call and we make sure that they're okay. And so that's what we are. We have the amount of times we have to say, this is actually why you hired us, is to call us in the morning, in the dark, when everyone else is sleeping, to make sure that you're getting your needs met.
Yeah.
sure. Well, and that just makes me think too, it's fortunate and unfortunate the age that we live in, right? We have so much information technology overload, right? And so sometimes a mom may be up at 3 a.m. Googling, is this symptom bad? Is this symptom okay?
Yeah.
Whereas, and then I think, unfortunately, we can get ourselves worked up or whatever. And it's like, if you have, a doula, that support person to be like, okay, don't Google it. Here's what you need to look out for. So it's kind of a side question, but do you all have like, do you tell your expecting mamas like, don't Google it, call me instead? Or like, how do you help people deal with the information overload of
Rachel,
expect?
stay off of Dr. Google.
I was like, stay off of Dr. Google, just call us and we'll figure it out.
Yeah,
Mhm.
streamline the information rather than
Yeah.
thinking that.
Yeah.
Yeah. Well, because Google's going to tell you, like, it's normal or you could die. And so, like, the range of, while there it's not lying, it's just, we day in, day out see the same sorts of
Yes.
postpartum bleeding. We see the same sorts of postpartum emotions. We see the same sort of weird contraction patterns in the beginning. And so, helping moms navigate what might be new to them, we can be like, oh, this falls within the variation of normal that we're familiar with, and we feel comfortable with your signs and symptoms, right? And then, of course, we always say, but if you're still concerned, we always pivot back to the provider, because again, we are not making decisions for them. We are really just a place for reassurance, knowledge, making sure that hey, yeah, call if you need that extra reassurance. That is
Right.
why you chose this provider. Um,
Yes.
so,
Leg
Yeah,
cramps normal. Yes. Try some magnesium.
yeah.
Uh, how many contractions are too many in early pregnancy? Let's talk to our provider
Right.
on that one. So,
mhm.
like, there's definitely a range, but
Yeah, it's like air traffic control, right, for birth.
yeah, for sure.
Great. Okay. I think we're back to Rachel now. No, are we at Alyssa? I can't remember.
I
Sorry,
think
guys.
we're
Okay, Alyssa, if someone can't afford a doula, are there community programs or ways to access doula support at a lower cost? I know this is a really tough question and one that probably most of our providers are hoping we have some magical answer to.
Uh, yes. Are they easy to find? Not always. So, the hope is moving towards some insurance coverage. Blue Cross Blue Shield just this year decided to help cover doula support. That is contingent on their plan though, which is always the case, right? Like navigating insurance. But we're hopeful that in the I say in the next probably 5 years that TennCare will start moving towards coverage. But in the meantime, yes, there are all kinds of different programs. I know Vanderbilt has their volunteer doula program. Um, we have a relationship with the providers here in Knoxville, and they know that we do donate services or discount services if there is a need. So the providers here would just reach out directly to us and say this is the situation that we've got. So unfortunately, I feel like they're hard to find the resources, but they are there and available.
Yeah, there's some doulas that'll take like I know what TRICARE.
Yeah.
There's a couple doulas in I think different cities that are qualified to take the TRICARE, which is the military insurance. And I've worked with some clients to help them figure out like they'll find on their insurance a midwifery clause, and if it's not used for midwifery services, they can often call their insurance and pivot it to doula services. But it isn't always a clear cut path. Usually, there's a lot of you have to really be motivated to make the call and be the squeaky wheel at this time. But we're hopeful. There's definitely movements in the right direction.
And always call an established doula organization. If you have somebody that needs doula services, we generally would be able to say, oh, we actually know of a training doula that's looking for just some help getting their credentials and are able to discount or even do some services for free just to kind of in exchange for that education. So there are always ways to find affordable doulas. You just have to dig for it a little bit.
Okay, great. And talk to us a little bit about that process. That just brings up something else in my mind. So in order to be a certified doula, what kind of training did you all have to go through?
Yeah, my certification was through Doula, and it kind of starts with a weekend long training where we're doing just like really hands-on practical. These are tools that you will use as a doula, but it generally is going to take about a year to get through all of the coursework. So there's a lot of independent study. There are several requirements of like jumping in on childbirth education courses, breastfeeding education courses. And then attending a set number of births as a support person, and having both the mom and the provider kind of write a review of the support that you're able to offer, creating lists of resources in the area, things like that. But it usually does take a good year to get through.
Yeah, I would agree. I'm certified through the International Childbirth Education Association, ICEA for short, and it's very similar. It was 1 year, a lot of independent study, having to do, I think I had to go through at least 3 births that were over 6 hours long. Again, get it signed off by the providers. And then what's important too about our certifications is that they do require a continuing education every 3 years. So we have to get the same like 24 CEUs within the 3 years to maintain our certification. So there's obviously different levels and motivations for all of for like doulas. We were talking at the beginning before we started recording was like it's a little bit of the wild wild west still, and so making sure that you're vetting a doula who really is staying on top of the ever changing maternal fetal medicine and the different reports that ACOG comes out with, because that is constantly changing, and we're definitely in a season right now where maternal medicine and the health of that in this country is kind of a topic, right? And so things are being spewed around and mentioned and policies are changing. And so, by maintaining your continuing education, then you're having a doula that, at least is got her pulse, hopefully, on the situation for the most part.
And doulas come in all different flavors.
Yes.
And that is a big piece of the picture too, is as you're interviewing a doula, making sure that that connection is there, because it is an essential part of the connection and relationship building. But we all have different specialties. So like Rachel and I both, we take a big focus on just normal physiological birth and movement and like, where does baby need to be? Where is your baby? Where does your baby need to be? Um, I have a little extra lactation training. Rachel has a little extra like trauma processing. So any doula that you interview may have a little bit different flair that they bring to the table, and we don't tend to be super competitive because we know that it is such a personal thing, a personal decision of why you have chosen the doula that you did. And it's because they have something that particular mama really needed and wanted on their team.
Absolutely. And where might be some different places that people could seek out doula services?
So a Google search is usually like the low hanging fruit in Google doulas near me. I would go also to the hospital of whichever like I'm choosing to go to this facility for my birth and reach out to them for who they connect with. So like we are both a part of like a doula collaboration program here in Knoxville, and so we work very closely with the policies of the Pacific hospitals that we're at. And I know Nashville has something similar as well, where, and that goes back to that earlier question about how we work really well with the providers and the nurses and the whole facility team is like, if we go in knowing a particular hospital's policies and how they're changing and how like certain rules around epidurals or other pain options, right? And when you can administer one versus the other, not only can we educate the mamas so they know what their options are going in, but we can kind of be like, oh, actually, this is a cool thing we haven't tried, right? And, we can talk to the nurse and be like, hey, is this available, right? And it just makes it oftentimes takes the burden off the nurses when a doula is present, is because we know where the towels are, we know where the nutrition room is, we know where the birth balls are, right? So like we can kind of help take some of the load off the nurses and when we're in the room with the moms.
Yeah.
So.
And if you're looking for more of like a statewide database, Tennessee Doula Association has a greater list of doulas in all areas. And one of their big goals is finding the doulas that are serving in the rural parts of the state too. So they kind of have a map of where all the doulas are and where you can find them. So that's probably the best resource for a statewide of where to find great doula support.
Okay, great. And we'll send that this afternoon in our follow-up too, so that you all can have that resource. Okay, awesome. Well, I am going to transition out of all of my questions and kind of open up the floor for you all to ask questions. But I do have a few just prompts for you all to think about. But kind of as we open up the floor, please feel free to come off mute, put things in the chat. This is just going to be an informal time of you all get to pick their brains, ask questions. Maybe something that you have seen a client dealing with, or you may want help with connection in a certain area. We may be able to help connect that today. Please feel free to go ahead and put those in the chat now. But we can go ahead and start with something that you all may have heard about doulas that you'd like to clarify or better understand. Maybe you have a misconception or something that you're like, someone told me this and I don't know if it's true. Don't all talk at once.
This maybe we've done such an effective job.
Yeah. Or any misconceptions that you think maybe your clients have had if they've had, hesitancy or things like that. I think the one that you brought up, Alyssa, about not being a midwife, I think a lot of people get the two confused.
Oh, for sure. All the time.
Yeah.
All the time. Yeah.
Okay, we'll go ahead and move forward then if we don't have any there. Has anyone here partnered with a doula before for one of your clients, and what did that collaboration look like? Anybody partnered with a doula? I know some of you all may be subcontracting with some doulas as well. If anybody wants to talk about their experience with that.
Hey, Brooke.
Anybody? Yes.
My name is Teresa Stritzinger. I'm a clinical care director at Pregnancy Care Center in the very east side of Davidson County, but primarily Wilson County as well, because we have a location in Lebanon.
Okay.
My staff nurse, Tiffany Langley, is also on. She's probably going to hate me for even bringing her into this, but I'm glad that you asked about collaboration with a doula because we do have a collaboration with a doula, and she's got a business where she has other doulas available. And so our ministry is faith-based nonprofit. We work with women and their families who are experiencing either planned or an unplanned pregnancy. And so we'll just through lots of assessment may identify a client or a patient who may benefit from a doula. A lot of times these will be clients who are alone. They don't have natural support. Maybe they have a lot of questions. There's a lot of uncertainties. It could be also a woman who, um, without that additional support may look for different options regarding her pregnancy decisions. And the doula that we've partnered with, and Tiffany, feel free if you're still on and listening, you can chime in. But we've worked with her to create birthing classes that we offer quarterly for our clients. And so it's an opportunity for us to think outside the box regarding, location and what the delivery method of that birthing class is, or childbirth class. It also gives us an opportunity to provide lots of really cool prizes for our clients. Um, and so there's that part of that collaboration. So they may not even have her as a doula, but she is an educator, in-person educator for our clients. Like I said, we do that quarterly. And then we'll refer our clients to her and her organization if they are looking for that additional services.
Okay, great. Thanks so much for telling us about that, Teresa, and all the great things y'all are doing at Pregnancy Care Center. I love that.
We do often hear from resource centers that send employees through doula training to be able to provide that greater support too, and love that. That's always really exciting when that is offered.
Well, and Teresa, you bring up a good point too, is that I know a lot of you all are working with moms who don't have that natural support system. And so, Rachel and Alyssa, what are when you work with clients who may not have a lot of other supports, how do you all help build that or, help that last for them?
Usually that looks like just more frequent check-ins, more, walking a little further through the process with clients. Open Heart, we have in the past been a nonprofit and we're able to serve a greater population. So we got to support families from Hope Resource Center and Bridge Refuge Ministries. And doula care is always going to look individualized. So it really is about what does this particular mom in this particular situation need and what kind of support is most valuable to them. And that's part of our job, is really just figuring out how to best support the individual person that they are in whatever situation. And so
Yes. And exactly. So to just tack on a little bit more is it looks like, okay, what is the holes, right? And what are the holes that they're kind of walking through? And so are they a part of a church community? Can we set up a meal train? Can we help them get a breastfeeding cart station going next to the couch? So there's little things like that to just make the little things easier, because over time those little things become really hard sometimes. But our desire is also to be like, okay, if we have a mom, we are connected with is it Mom's Connection? I should know. But the diaper resource centers and all of that. So we have a whole list of resources that, depending on a mom's needs, we can go, hey, call them or reach out to this program. So getting our resources, we always love to grow that.
Yeah, no, that's great. Carla said in the chat, I never have, but would like to work with a doula. Carla's in the Johnson City area. Rachel and Alyssa, are y'all familiar with anyone there that could potentially partner with Carla at Fairview?
I think that there is a doula group in that area. Off the top of my head, I don't have the information, but it is information that I could pass along for sure. Yeah.
Okay, awesome. Yeah, that'd be great. And I can get that to Carla. Ami says, what would it look like for a doula to assist with a mom who is making an adoption plan? And Ami works with Miriam's Promise, who is, I think, Ami, you can correct me if I'm wrong, predominantly working with adoptive parents, correct?
Correct. Usually it's mothers who are making adoption plans, but we also work with moms who are planning to parent. And that looks a little different because the support needs are different. But some of the things that we run into with adoption plans is um, we had one case in particular where the mom was working with the doula. The doula was aware of the adoption plan and did um, was not very supportive of the adoption plan. And mom was really sure of that being her plan until the doula told her that she could parent. And there were some outside influences that made it really difficult for that to happen. So, as a general statement, like how does an adoption plan change your work, or how should it change your work?
For sure. I have got to support a client in that very scenario. And for that particularly, it really, you kind of are a bridge, in the room, right? So, um, while the focus primarily is on like the laboring mom, like what kind of support do you need, but also folding in the rest of the birth team. So when that, that might look like the adoptive mom being a part of the process and connecting those pieces, like how can we help to make that very hard adjustment like a really smooth and beautiful part of their story. um so
One of the things we stress in our consultation is our desire is their desire. Like it our desire as a doula should never, and this goes back to the scope of what a doula, if a doula is staying in scope, really truly it isn't our birth, it's their birth. Our job is to educate, our job is to support, but ultimately we are not supposed to influence. And sometimes the providers don't like that too much because they really want us to use the trust that we've built with them for them to make a medical decision, right? And so that can get some sticky situations for us, but we really are supposed to be this middle,
leave your bias at the door,
neutral space. And so I hate to hear that situation because it does sound like the doula maybe stepped a little bit out of scope and didn't quite understand maybe the whole situation. And it probably wasn't with ill intent, right? Probably trying to be encouraging and all of that. But at the end of the day, walking alongside moms, and I would assume like you were a part of the team. Like if we were to be in that situation, we're like, okay, what programs is she already walking with? Okay, what is the case manager of this? Let's really make sure that we are really a cohesive team and everyone is on the same page. I don't know if that helps answer.
It does. Thank you.
Great. Okay, and then Faith wants to know, do you provide education for anyone else also involved with mom during the birth? Fathers, other family members, and friends?
Yeah.
Yeah, I mean, generally, like childbirth education courses are tailored mostly to the birthing couple. But we have had family members come to be involved in our prenatal sessions. It really just depends on, what the mom's preference is. Who are they inviting into their space? And then how can we help everyone in the room be comfortable with birth? Because not everybody comes in with this like, oh, I've been to a ton of births and I'm super familiar and comfortable with that space. Sometimes we have siblings that they want to be a part of the process, and just kind of helping give them resources of how to make their child comfortable in the room. And just, I mean, it really comes in just a lot of like, yep, this is totally normal. Mom's okay. Your wife's okay. Your daughter's okay. We're doing great.
Yeah, birth is so unique that it's really hard to prepare the support people for every possible scenario. But what we are in the room is the person that makes eye contact with dad and goes, oh, that's normal, or oh, that's really encouraging, or she's completely fine, this is great. And the amount of dads after the fact who are like, I'll never do this again without a doula.
Get your wife a doula. There are
The dads typically become our biggest advocates because they're like, oh, that cold washcloth that we slipped behind her back, and the mom was like, how did you know I needed that? And we're like, we got you, right? You know, and our job doesn't replace the support people, you know, usually dads, right? We like to say dads and doulas make a really great team, because while we are the expert in birth, the support people are the expert in that mama, you know? And so, you know, really that goes back to that cohesive team and us making sure that everyone feels comfortable in the room.
Yeah.
Yeah, it's like you all are there to hand out jobs, right? You know, you can do this, you do this, you help with this. It's great.
Yeah.
Great question. Okay, any other questions? Feel free to put them in the chat. I think I just have one more for you all. What questions do your clients often ask about birth? Maybe they're anxious or scared or unsure about that you wish you could answer better. Any questions about birth that have come up with your clients or families that you're working with, especially with first-time moms, right? I feel like all the things people want to know, all of it. Or unfortunately, I think there's also the scenario where people's friends tell them horror stories, right? Well, this could happen or this could happen. And so maybe Rachel and Alyssa, you all could talk to that of, you know, how do you calm down a first-time mom's fears, especially when maybe everybody might be telling her all the terrible things.
She's laughing at me. She goes, say your spiel.
So she's got this one.
Usually we coach our mamas a lot, especially as they enter the third trimester, to protect their mental space, and to do it with a loving no. And so what that actually looks like is little phrases that they can say. And my favorite one is, hey, I would love to hear your birth story after I've had mine. Hollywood really only shows the dramatic, like, rarities of birth. And the amount of times that every Hollywood or TV show and the screaming and the crazy, and it's like
in a 30-second snapshot.
Yes. And you're like, no, this was a 24-hour birth and it was joyful and peaceful the whole time. Like, that can happen, right? And it's okay to make noise, but we're probably not screaming like our fingers were just cut off, right? And so people don't realize, women don't realize that the subconscious narrative of our world is powerful. And so I'm a very strong proponent of, like, let's rewrite this narrative. What lies are we believing? And actually, this is a very normal process. And for the most part, your body's going to do exactly what it needs to do in the time that it needs to do it. And how do we make that pace match whatever, like, medical model that they've chosen to labor with? So
an observation that we have had is that women tend to approach birth differently when their mothers spoke to them positively about birth. And so it just really speaks to the power of, like, what that, like, positive influence. And you know, birth can be really joyful, or even just that I'm so excited for you, right? Like, rather than, oh, I remember that was awful.
Right. And so, like, every birth that we get to help a mama have her baby, like, in an empowering, peaceful way, like, we really do think we're shaping legacies, because that mom's then going to tell their child what a great birth they had. And that baby's going to grow up, both boys and girls, sons and daughters are going to grow up being like, oh, like, this is actually something that is really remarkable and amazing and isn't terrifying. So, and that goes back into the mental work that Alyssa and I do, is we really do spend a lot of time, hey, what has shaped your outlook of birth? What are we starting with? And then we spend the months walking with them, kind of reshaping their narrative as much as we can, to the positive, if possible.
Sure. I love it. Changing generational outlooks, one birth at a time. Y'all are awesome. Y'all can feel free to put any other questions in the chat as I close us up, and we can have any last minute questions that we need. But thank you so much, Rachel and Alyssa, for being here today, for being vulnerable with us and talking with us about something that you all clearly love, and are very good at, supporting moms in labor and birth and the postpartum period. We really appreciate all of your insights and learning from you today. And thanks everybody for your questions and contributing to our conversation today. I hope that you enjoyed learning with us. We will see you all soon. Thank you for being here. Have a good afternoon.